First speaker is Dr. Burman, Roy Burman. Arup Roy Burman is the co-founder and CEO at Elemeno Health. I don't want to spoil the introduction, so I'll let him introduce. Arup, you're on.
Great. And so, Uli, I've got 15 minutes to share with you all.
Yes.
Awesome. Hey, thanks everyone for making time and joining us here today. Like many of you, I am also a physician entrepreneur, former medical director of the ICU at UCSF Benioff Children's San Francisco, where we developed the prototype for Elemeno Health. So I'd like to walk through kind of a slide-based story of us, and a little bit of a demo, and segue from that into a little bit on crowdfunding, which we'll pick up a little bit later in the panel discussion. So with that said, I'm going to share my screen here. So this is where my story starts. This is my sister, Urmila. She was born 50 years ago, born with a ventricular septal defect, pretty run-of-the-mill surgical problem nowadays. She was managed at Children's LA. And when she was 4 and I was 8, she went for what should have been her final surgery, release of a PA band, something pretty simple. Unfortunately, something went wrong in the OR. There was a mistake, and she died in the OR. This is something that my parents now, who are well into their 80s, remember like yesterday. And for me as well. It was my first experience with a medical error. It was also the inspiration for me to go into medicine, to go into peds, to go into critical care, and ultimately care for children with congenital heart disease. And my clinical career spanned 20 years between Stanford, Children's Oakland, Kaiser, and UCSF. And in every one of these fine institutions, I've continued to see patients die from mistakes, preventable mistakes made by well-meaning, well-intentioned, well-educated, hardworking staff who simply couldn't pull the information they needed when they needed it. And at the same time, we saw the rise of technology in the consumer space. And we saw in the Bay Area how this little device and our laptops and our desktops were the great enablers for us as consumers, making our lives easier, connecting us with others, giving us the information we need in the moment. And we asked, why aren't those same conveniences in healthcare where the stakes are so much higher? And that then leads to the story of Elemeno. So Elemeno, I'm proud to say we were recognized earlier this year by the Jewish Healthcare Foundation as the #1, the unanimous choice for top innovation to be able to empower frontline staff and eliminate errors. JHF had been around for 22 years, and it concluded the place that information is needed most is right in the moment, in bite-sized when it is top of mind. And that's what we do. So Elemeno is a B2B cloud service. We help systems deliver just-in-time training, communication, and support to frontline healthcare teams. You could think of as an enterprise solution to department-based issues. We directly empower the ICU manager to lead the ICU, the OR leader to lead the OR, the ED manager to lead the ED. Our goal is to be able to help systems quickly train, support, and retain staff, to decrease care variation, improve safety, decrease labor costs for training, and ultimately do this with no IT need. So we directly empower those teams through the cloud. We have no protected health information. There is no HIPAA concerns. We can go live in as little as 1 day. These are the challenges that we're going after: staffing, errors, and costs. We know that we're never going to have enough staff. We're going to be short 1 million nurses by 2024. And that gap is not going to go away. Care is becoming increasingly complex, more and more decentralized. People are living longer. We need more staff. So what we seek to do is help people level up, cross-train, give them what they need so that you can retain them. We seek to reduce medical errors, and we seek to reduce costs. In the words of one of our end users, it's impossible to remember every procedure and protocol. It is just massive. And so how do we make that easier? The problem today is that we're still using Methods from the last century or even from centuries before, in-person training, in one ear, out the other. It's non-contextual. In the era of COVID, it's not safe and it's expensive. Then we've got the binders, the flyers, the SharePoints, the Dropbox, dumping information everywhere. God knows what it is, if you can find it, and if you find it, can you even digest it? Ever-changing numbers of workflows, cognitive overload, and then we've got the emails. The end result is we can't train our staff. They're not confident. We've got practice variation errors. We've got inefficiencies and waste. We solve that problem. We give each department an elegant and simple just-in-time training and support solution, customized for that department, so that your frontline staff, whether they're doctors, they're nurses, they're RTs, are always current on information. Information's quickly updated. It's optimized for web and mobile, and they can engage it whether they're at work, in transit, or at home. The learning moment, that's when you want to give the information. So let me actually jump from here to showing you a quick demo. So this is looking at us on UCSF on a desktop. If we're on mobile, it simply scales down like this, any device. Branded for the organization, labeled for me. Easy UX, where I can search for what I want. I can favorite my own content. A manager can assign me content. I can come in here. I can choose what unit am I in today. I'm in the ICU, the CICU. I'm at the ED at Parnassus. In the ED, I can see what's my most recent update. And I can see now from my manager, you know, the height of COVID, she was updating this multiple times a day, Dr. Jean Noble. And so here you can see that Regeneron, no longer available. We're using the BAM cocktail. We've stopped universal testing. If we want to do point of care testing, patients do it themselves. Here's what it looks like. So we can see, lace this with picture. We can bring in video. Different kind of example for docs while we're staying in the emergency medicine side. Residents said, every attending teaches me a different way to do it. Can faculty, you just show me the right way? Faculty got together and said, okay, sure, let's do that. In fact, let's do that with all of our procedures. And we can see in here for procedures, I can tell that here for, okay, let's look at central lines. And for central lines, I know this is my equipment that I need. I need a kit, I need my flush, I need a dressing. And this is where it's located in my cart, in my hospital. I can quickly find it. And when it comes time to the procedure, I can see the picture and I can see text in the moment to refresh me, remind me how to do this right. The beauty of this type of content is UCSF makes it shareable. So then Community Regional Medical Center in Fresno said, ooh, a manager said, I like it. I'm going to take it, same content, but I'm just going to substitute this piece. So we drive knowledge sharing as best practices flow from one institution to another. Last example I want to show is on the nursing end, because nursing is the bulk of our frontline workforce. Say you've got a traveler, you've got a new hire. They're now here at in the CICU. If they simply look up orientation, they can find what's expected of me. What's expected of me in my unit. I can see that. Drum roll here is, sorry, running Zoom. It keeps it a little slower. You can see my weekly orientation. And I would see there that, week one, here's the duties that are expected of me. But the duties, you know, I can see what do I do before my shift? How do I give meds, so forth. Or it may be as simple as, how do I load my CR monitor? I can see that in a series of pictures here. Nice and simple. I can take complicated decision guides that may look like, say, a mess like this, and I can change those to quick walkthrough, bang, bang, bang. If I don't understand something, I can get more information here. Similarly, another client gave us their ED neurosurgery pathways. What do I need to know? Got pages and pages of this stuff. Hard to figure it out. But I can come in here instead and I can say subarachnoid hemorrhage. I'm looking for that. And I quickly get to what is what's inside that protocol. Click on here and I can see subarachnoid hemorrhage. This is what I need to do. So the reason that we did all of this is to get information to people quickly. And then the question would be, does it actually make a difference? And so that's what I want to share here, is that yes, it does. We've had our clients show that patient safety events, serious patient harm, which had happened once every 7 days, now happening once every 28 days. Central line infections cut in half. educators delivering their content 75% faster, less time, participation going up 2.4x, and the combination of decreased turnover, decreased errors, and decreased training time, saving hospitals $5 million a year. Every user we track what they look at, what they like, what they don't like, what they're searching for that they can't find. This gives managers deep intelligence into the behavior and needs of their staff. We've got growing traction, 300% growth in the past 3 years. We're at $1.4 million of ARR with a $5 million pipeline. We have no churn. All of our subscribing clients are renewing and they are often expanding. If we didn't sell a single new logo, we would have $6 million of ARR expansion right there. Every one of our clients is sharing at least some of their content with other managers. Some are sharing everything. And so this creates a community, a growing barrier to entry and a barrier to churn. We're a land and expand model. We start at 25, 30, 35K, and we can grow that up into the 6 figures. These are real clients. And instead of selling just one-to-one, we also sell one-to-many. We have new channel partners, the National Perinatal Information Center, partnering with us to sell to maternity and NICU units, Texas Hospital Association, partnering with us to sell into Texas. It's a big market, just suffice it to say, there's a lot of money there. It's a big problem. Our big picture vision is to be the go-to network for best practices worldwide, driving this content sharing, to radically reduce medical errors. We're a mission-driven organization, and ultimately to empower every healthcare professional to provide the best care possible to every life they touch. We've got a team led by doctors and nurses. My co-founder is coming from the world of Athena Health, successful exit there, helping to grow them to 1.3 billion in revenue. And we're about people who are intensely focused on the end user. Our content continues to grow. That is shared. And at each hospital, we've created this ecosystem, proprietary content, a delivery system, and a frontline user network. Those are the eyeballs of the front lines, which can be monetized by device manufacturers, diagnostics, and clinical trials as well. We've had steady growth. We're looking to hit our targets here, about 2 million ARR at the end of this year. And the investment opportunity we're raising right now, 5 million, to be able to drive our sales and marketing, to drive our expansions, and on the product end to grow out that shared content library. Our core values here are about elevating quality by empowering the front lines with knowledge and engaging us as an interprofessional team. And 2 sites that I just want to show you is that we are raising right now on Start Engine. Our campaign to the crowd is open for 1 more day. It closes tomorrow. I can share more of this later on today. And also we were recognized by ACEP, the American College of Emergency Physicians, as one of 4 finalists for Innovation of the Year. I can forward this link later, but we're here if you want to, or we're one of these in here. Here we go. If you get into us and take a look at it, if you vote for us, you can vote for us to get us as #1 with the voting going through next week. So, okay.
Do you want to talk a little bit about your crowdfunding?
Sure. Yeah. So from a crowdfunding end, we're right now raising on Start Engine. This is our 2nd time around. First time around we did last year on Republic. I can share that maybe later in the panel discussion, but on Republic last year, we raised 1.07 million from 4,000 users, 4,000 investors, including many of our frontline users. We had nurses, doctors, RTs who all invested, who are using our product. And this year, because the SEC regulations changed and allowed you to raise more in a 12-month period, we opened up on Start Engine. And Start Engine, you can see here, we've raised another 1.225, and we've got some more coming on top of that. So in the panel, I can talk a little bit about the difference between the 2 platforms and where my experience has been and what might be of more interest to you.
Great. Thank you very much. Let's go.